Richard, thanks so much for joining me. I really appreciate you coming by to share with me more about what you're doing. So I want to understand, first of all, you're creating a wearable. It's a watch. I'm wearing one. I'm wearing a smartwatch now.
Yep.
I'd love to learn more about yours. What is the product that you're making, and how does it work?
So our company's called UnaliWear, and the watch is called the Kanega watch. This is the Kanega watch, and it's a particular watch designed for people that are interested in medical alert devices, kind of the "I've fallen, I can't get up" industry. That is, quite frankly, a very stigmatizing industry because most of the devices that are out there are pendant-based. And we created a watch. It's in market now. We have users all across the country, and it's designed to provide fall detection uniquely on the wrist, as opposed to being around the neck. And because of its patented battery system, you never take it off to charge. So the industry's daily average use is about 30%, and nearly 90% of our wearers never take their watch off. When they shower, when they're in bed at night, and they get up in the middle of the night, they're protected. That just doesn't exist in this industry right now.
So your target market is seniors,
Primarily.
who are living independently?
Mostly, yeah. I mean, our tagline is independence with dignity. So we're trying to provide dignity to people that want to live in their home, want to age in place, and in many instances, they're living alone, sometimes recently living alone because of a death of a partner, and they want to feel protected, they want to feel safe, they just don't want to feel like they're being badged as being old.
You referenced that old commercial from the 70s, probably. I know it's definitely the 80s. Is it? Okay, so I'm falling and I can't get up. So that does create a very negative sort of impression of these sorts of devices. So how are you combating that? What needs to be done to try to destigmatize people having what looks like a very cool, fashionable wearable on their wrist?
Well, I think it's just getting the word out there more that we exist. We're building very nicely as a business, having a lot of success, getting a lot of referrals from current customers, talking to hospitals about remote patient monitoring and using this as a hub in the home because it's also Bluetooth enabled. So there's a lot of ways we can keep growing, and that's kind of our moonshot. You know, there's a lot of options out there that are primarily pendant based that people aren't wearing, and we feel like we have an option that people will wear proudly, and we'll wear 24/7. And that's the key here. If we can do that, that's our success for our company, and that's really our success for the world around us.
So you said you need to get the word out there. Word out there to whom? To adult children of aging parents, to healthcare providers? Who's making the buying decision, and who needs to be the one to say, I'll take one?
So in the end, the user has massive veto power.
Of course.
We call it MVP in our company. And so the child or the caregiver can look and shop for them, but they have to be willing to wear it. And so many times we're getting people who have never been in this category before. They should be in this category, but haven't been a wearer before because they've been turned off by the current options. So we feel like every time we acquire a new wearer, we're getting somebody that would have been unsafe and unprotected and have chosen us to give them that option that they never thought existed before.
Now you mentioned earlier, and I just want to get clarity on it, you mentioned that only 30% of wearables are worn. Not your wearable though, yours is around 90% if I understood that right.
Correct.
So that's because of this unique, patented, I believe, battery charging system that allows people to wear it almost all the time, in the shower, everywhere else.
They can wear it 24/7. The batteries, the watch comes with 4 batteries, and 2 go in the watch and 2 go in the charger. They swap batteries out every day to 2 days. The watch will tell them that. In addition, the 30% is for the industry average. So people who have the pendant-based options, they're wearing them about 30% of the time. And as I told you previously, about 90% of our wearers never take their watch off. It becomes a part of them. And of course, the watch, unlike the pendant, gives you daily benefits, habitual generating benefits. It tells you the time, it tells you the date, it's got medication reminder functionality. So you're getting real habit-forming benefits every day you wear this watch, and so after a while you just don't want to take it off because it's giving you benefits that you want to have, and you're used to it, you become comfortable with it. So that's another benefit as well.
You mentioned when we were speaking earlier that night is a very vulnerable time for a lot of your users, so I could imagine that some sort of lanyard-based device is not something they're going to pick up from the bedstand or the nightstand and take with them as they're trying to make their way down to the bathroom in the middle of the night. But if they're wearing a watch, a lot of people sleep with watches on, so that's something that's going to be able to track them for what? For falls or for activity? What are you tracking?
Well, we're tracking for falls, right? So it's got built-in fall detection, but it's also voice activated, and it's also button activated. So you're absolutely right. If they get up in the middle of the night, use the bathroom, and they have an issue, they can get help through their voice, through pushing the help button on the watch, or just by having the fall detection. If they fall, identify that, and that goes to a private monitoring center. They talk to the person through the watch, assuming the person is responsive, and they have all that person's medical information. They know if they have diabetes, they know if they have high blood pressure, they know what medications they're taking, what allergies they have. So in case they actually have to dispatch an ambulance, they can provide that information to the EMTs, so they're much better able to assess from the second they get in that door how to handle that person.
Wonderful solution, wonderful solution. So what's in store for you over the next year? What can we see?
I mean, continued growth. Your point about the bathroom is really a really critical point we try to raise. I mean, if that device, and that could be the watch you're wearing, which also has fall detection but connects to 911, the Apple Watch does that. It's a fine device, but it's probably sitting on the bedside table when you go to the bathroom. And similar to the lanyards, we talk about the fact that if you're 10 feet away, you might as well be 10,000 miles away from your device. It has to be worn. And so our goal is to keep spreading the word, keep growing. We're going to be building more partnerships with healthcare companies, particularly as it relates to remote patient monitoring. And really, we continue to try to just stay focused on the North Star, which is really non-stigmatization of this business, of this industry, and giving people a real opportunity to stay safe and protected for themselves and their family in a way that doesn't make them feel old.
I remember years ago I bought a Fitbit for my grandparents, trying to get them to be a little bit more interested in their mobility and their activity. That didn't go down so well. But there are certainly going to be other children and grandchildren who are looking for presents or something to try to push their parents or grandparents into making some healthier decisions. How would people actually go about finding your watch and procuring that for them?
They can go online to UnaliWear.com. We also have a number of referral partners, kind of home care agencies and other kind of people that are interacting with seniors every day, and they speak on our behalf and can talk to their patients and their customers about us. But basically, the best option is really go online to UnaliWear.com and learn about our business. And most people who come there find that that's the solution for them.
It's a great looking device. It seems to have a lot of fantastic functionality. You've solved one of the problems that I have with this thing, which is the battery life and not being able to wear it for part of the day because it just needs to be sitting on the counter.
Can I show you how easy it is?
Sure, let me hold the mic. Yeah, show me how to do it.
So a couple of things. One is that I said it's voice activated, so Fred Astaire, get help.
I think I heard you ask for help. I am contacting the operator. Press the crown button once if you do not need help, and I will cancel the call.
Impressive.
And then the battery in each side of the watch, you just simply remove it, comes out, same side, other side, simply remove it, comes out, very simple, very easy for people that have limited dexterity. It's designed that way. You'll also notice that the watch is white on black for people that have macular degeneration issues. And you'll also notice that both batteries are out, but the watch still functions. That's a fail-safe internal battery in the watch to ensure that even if someone doesn't change the batteries before they go to bed at night and they need to, the watch will last for 6 to 8 more hours. So we've really thought this through. And for the people that have the watch now all across the country, we are giving them and their families, tremendous peace of mind, and we're really proud of what we do.
Excellent. Well, thank you so much for showing that. I wish you great success and continued growth as we go into the year and years ahead.
Thank you so much.
Thanks for coming by.
Okay.